Hello and welcome. I'm Dr. Ankit Parakh and I work as a consultant in pediatric pulmonology, allergy, and sleep medicine at Children's Chest Clinic, New Delhi. So, in this video, we'll be talking about daytime symptoms of sleep apnea in children. Now, sleep apnea in children is frequently underdiagnosed, overlooked, and the diagnosis usually is quite delayed. Now, most people understand that sleep apnea have nighttime symptoms like snoring, difficulty in breathing, pauses during sleeping, sleeping in abnormal postures. But recent research suggests that many children with sleep apnea have daytime symptoms as well. Now, why do children with sleep apnea develop daytime symptoms? Now, children with sleep apnea do not get a proper sleep, also known as restorative sleep. Now, if children do not sleep properly at night because of continuous apneas, hypopneas, and difficulty in breathing, the quality of sleep is low and hence they develop daytime symptoms. So, what are the common daytime symptoms that we see in children who have sleep apnea? Now, similar to adults, a lot of children with sleep apnea have difficulty in waking up from sleep. When they wake up from sleep, even after a good 8 hours or 9 hours of sleep, they feel groggy and they are tired. They do not feel refreshed. They can be sleepy throughout the day. They can doze off during their classes or when they are coming from with their school bus from the school to home or vice versa. The other common problem seen during daytime is the behavioral symptoms, the neurological symptoms, and the cognitive symptoms. Aggressiveness, hyperactivity, and irritability are very common symptoms of sleep apnea in children. Children try to keep themselves awake by becoming more hyperactive, and that is the reason why children with sleep apnea become hyperactive. So, any child who has attention deficit hyperreactivity sort of symptoms should be evaluated for sleep apnea. It has been shown that children with sleep apnea can have deterioration in school performance, their academic grades can go down, their mathematical skills are poor, their verbal fluency is poor. Now, in addition, a lot of children with sleep apnea can have medical problems, which could be in the form of high blood pressure, increased pulmonary pressures known as pulmonary hypertension. They can have metabolic syndromes. They can have huge weight gains or obesity, and they can develop diabetes later. Now, some children with sleep apnea tend to have a very poor height and a very poor weight. So, how do we diagnose sleep apnea in children? Well, the index of suspicion should be quite high if any child presents with these sorts of symptoms. So, children who have any of these daytime symptoms like poor school performance, reduction in the academic grades, they're excessively sleepy, children who are having a poor weight gain, they're obese. Now, these groups of children should be evaluated for sleep apnea, and it should be borne in mind that these symptoms should not be neglected. Now, for diagnosis of sleep apnea in children, we need to do a sleep study, also known as a polysomnography. So, if your child is having any of these daytime symptoms, remember it can be a manifestation of sleep apnea. You need to get in touch with a sleep specialist for evaluation, consideration of a sleep study, and further treatment. Thank you.